So good morning, everyone. Welcome to the webinar on fibromyalgia. My name's Bree. I'm the Health Promotion Coordinator for Arthritis Queensland, and today I'll be discussing fibromyalgia. So this webinar will be slightly different today, as I do have a very special guest joining me, Geraldine. She's one of our beautiful peer mentor volunteers, and she's agreed to come on and have a bit of a chat with me at the end of the presentation today, which is really, really generous because Geraldine's on holidays at the moment. So thank you. So Geraldine lives with fibromyalgia and has a wealth of knowledge on this condition for living with it for so many years. So I'm looking so forward to having a chat with you today. All right, so just to start off with, I'm not an expert in fibromyalgia, so this presentation does contain general information and advice, and every effort has been made to ensure that it is accurate and reliable, but it's not a substitute for the individual treatment and advice from your doctor or rheumatologist or other health professionals. So always have a chat with them to get that individual medical or treatment advice. In the spirit of reconciliation, Arthritis Queensland and New South Wales acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. All right, so today we're going to start off discussing what fibromyalgia is. We're going to talk about some of the common symptoms and the diagnostic criteria that's involved in diagnosing and identifying this condition. And then we'll move on to some effective strategies for managing fibromyalgia. And then we'll discuss who can help, so which healthcare professionals can help you manage this condition. And then we'll finish off by talking about how to effectively manage flares when your symptoms worsen, and also discover some useful resources and additional support as well. All right, so what is fibromyalgia? So I am going to insert the poll. Bear with me while I find it. I've only used this one once before. So, all right. Can everyone see that? Yeah. Okay, so do you think fibromyalgia is the first one, which is a digestive disorder that affects nutrient absorption? Or do you think it's the second one, which is a condition that causes widespread musculoskeletal pain and fatigue? Do you think it's the third one, which is an infection of the respiratory system? Or finally, the last one, which is a skin disease that results in rashes and itching? So I'll just wait a little bit longer while everyone gets there. And this is anonymous, so we can't see who voted for what as well. So, all right, so a few more responses coming in. That's awesome. All right, a couple more seconds. Beautiful. So it looks like everyone has selected the second one, which is a condition that causes widespread musculoskeletal pain and fatigue. So that is definitely right. So fibromyalgia. So this is a chronic condition where the main symptom is a long-lasting chronic pain that may affect the entire body. So this type of pain is not brought on by an injury. It's a name given to a group of symptoms, which is marked by that generalized pain and muscle stiffness. So these symptoms can be felt in all different areas of the body. Extreme fatigue, which is that tiredness, and sleep problems are also a common symptom. Fibromyalgia does not cause inflammation or damage to painful areas, but it may be due to an overactive pain symptom. It is not rare and can affect around 2 people out of every 100. Anyone can develop fibromyalgia, but it's twice as common in women. It can be more common in middle-aged people and people who have painful bone and joint conditions, such as inflammatory forms of arthritis. It is a poorly understood, and sometimes it can be a really frustrating condition. People can wait many years before actually getting a diagnosis. So those who have fibromyalgia may also be more sensitive to pain than those who don't have it. There is no known cause for fibro, but it is treatable and manageable. Okay, so we are going to now insert the second poll. So what is the most common symptom of fibromyalgia? So I'll just find that one. Oh, right. Now, I think the other slide would have given the response away, but do you think it is the most common symptom is frequent headaches, that widespread musculoskeletal pain? Do you think it is a persistent high fever or elevated blood sugar levels? All right, so I can see some responses coming in, which is amazing. All right, give a couple more seconds. Beautiful. Everyone is all over it. It is that widespread musculoskeletal pain. So the common symptoms of fibro, as we've discussed already, is that widespread pain. So that persistent chronic pain that can be felt throughout the body or in multiple areas. So pain may also often be felt in the arms, legs, head, chest, abdomen, back, and buttocks. So you can see that widespread pain is, you know, around all different parts of your body. So it's that all throughout your body. And those with fibro often describe that pain to be kind of like a burning sensation. It could be that aching or throbbing sensation as well. Fatigue is another common symptom, and that is that severe tiredness that doesn't actually improve with rest. So, you know, you may find that sleeping long periods of time and you still wake up and have that real fatigue and just that feeling of not being able to really get much done because you're so tired. So a lot of time people can feel really tired and have no energy at all. There is also sleep issues as well. So some people with fibro can have trouble sleeping, or they can have trouble getting to sleep because their mind is going 100 miles an hour. And they may also frequently awake lots during the night or not have that non-restorative sleep. So they sleep and wake up and not feel restored that you usually have from having a really good sleep. Then there's cognitive difficulties. So often people with fibro, they refer this to as fibro fog. So this includes problems with memory, concentration, and mental clarity. So some people report having problems concentrating or remembering things. And then some of the other symptoms include headaches, and fibro can also upset your stomach. So people with fibro tend to have irritable bowel syndrome, which is that tummy pain and that bloating. It can also make you feel dizzy or numbness and tingling in your hands and feet. And then sometimes people may have that hypersensitivity to noise, light, and temperature. They can, people with fibro can also sometimes feel frustrated, they can feel worried or down. And this just shows how fibro can affect all the different body systems in you and how they're all interconnected. It's really important to note that the symptoms of fibro often overlap with those of chronic fatigue. So some doctors may diagnose you with chronic fatigue if you've got fibro because they're quite similar symptoms. All right, so now we're going to discuss diagnosing fibromyalgia. So it can be really challenging to diagnose it because there's no specific lab test for the condition. So the body's issues can appear normal when examined by a doctor, and there's no actual blood test or there's no x-rays or scans that test directly for fibro. So your doctor or your rheumatologist may look for a few different features that are quite typical to fibromyalgia to help diagnose the condition. So a common indication of fibro is whether you've had that pain that long-lasting pain for 3 months or more. So some other things that they might do to help diagnose it is complete a history and symptom evaluation. So this is a thorough review of your symptoms and your medical history. So they will discuss your symptoms and how long you've had them. They'll ask questions about your general health and your family history. And this will include whether anyone in your family has had a similar pain condition. Then they might do a physical examination. So they may assess areas of tenderness and pain. So they will apply pressure to the muscles, the joints, and your tendons to see where that tenderness is. And that can be all over your body. They may also check for signs of nerve pain and pins and needles as well. The next thing that they might do is an exclusion of other conditions. So they might take some blood tests or do some imaging studies, so like X-rays, MRI, all of those type of things. And they do this to rule out if you've got any other conditions with similar symptoms. So this could rule out if other forms of inflammatory arthritis, such as rheumatoid or lupus. So the diagnostic criteria. So this may include seeing whether you've had widespread pain lasting more than 3 months and the presence of symptoms like fatigue and poor sleep, and also those cognitive difficulties that have lasted for several months. So what causes fibromyalgia? And, you know, the exact cause of it is still unknown. So in the past, doctors believed that there was only 2 types of pain. So pain caused by tissue damage. So this could be done through injuries or surgeries, and it's caused that tissue damage. Or it could be pain caused by nerve damage, which tends to happen if you've had shingles. Now, medical experts know that these descriptions do not explain all painful conditions, and they've actually identified a 3rd type of pain. And this is an increased sensitivity to the pain system, also known as hypersensitive pain. So in hypersensitive pain, our bodies signal that it is in pain, even though there is no clear sign of any tissue or nerve damage. So fibromyalgia is a hypersensitive pain condition. People with fibro are extra sensitive to warning signals, and their bodies respond differently to them. So typically, the nervous system processes pain signals to alert us to injury or harm. And however, in people with fibro, this system becomes overactive. So it amplifies those pain signals, causing pain even when there's no actual injury. So it's like that pain dial is turned up really, really high. So this heightened sensitivity is often due to changes in the brain and in the spinal cord where the pain signals are processed. So the brain may overinterpret normal sensory signals such as painful, and the spinal cord may increase those painful signals. People report that it's like having an oversensitive alarm system, which sounds its alarm even when the body is not under any threat at all. So both the central nervous system, which is our brain and our spinal cord, and our peripheral nervous system, which is our nerves that transfer information between our brain to the rest of our body. So our central nervous system and our peripheral nervous system seem to be extra sensitive to these warning signals. And the hypersensitivity of the nervous system can explain why some people with fibro can be sensitive to noise and light. So are there any other factors that can increase the likelihood of developing fibromyalgia? And the answer is yes, there are definitely some factors that can contribute to developing fibro. And these include being born female. As I've mentioned before, it's twice as common in women than men. Growing older, so fibro is common in people who are middle-aged or older, and it also may run in your family. So there might be a genetic factor to developing it as well. Inflammation. So when our immune system is challenged, it can make our nervous system more sensitive. So this may trigger the development of painful conditions such as fibro. If you've also lived with other forms of arthritis like rheumatoid arthritis or lupus, even osteoarthritis, or if you've had chronic back pain, and inflammatory bowel diseases. So these can increase your likelihood to developing fibro as well. Accidents. So if you've had a traffic accident or a work injury, or if you've had fractures, broken bones, or something that's been quite traumatic to your body. Also medical interventions, and complications from surgeries or infections, like really severe infections, and also emotional traumas. So if you've experienced abuse and neglect, these may also predispose you to developing fibromyalgia as well. But it's really, really important to note that the exact cause of fibro is not known, and that these factors may predispose someone to developing it, but they also may not. So people may experience all of these different things and they may not even get fibromyalgia or develop it. So these are just some common themes that are seen in people with fibro. So it's not saying if you've experienced it, you will develop it. All right, so who can help? So the good news is that you can effectively manage fibro, and utilizing multiple approaches and a team approach is one of the best ways to help you manage it. So this is referred to as a multidisciplinary care, and it involves you and your healthcare team working together with the support from your friends, your family, and community organisations. So you can manage fibro with your healthcare team by having open communication, so regularly discussing your symptoms, your treatment responses, and concerns with your healthcare providers. Clear communication helps in tailoring treatments to your specific needs. And as mentioned before, having a multidisciplinary approach, so collaborating with a team of healthcare professionals, including rheumatologists, pain specialists, physical therapists, so exercise physiologists and physiotherapists, and mental health care professionals. So these can help address various aspects of the condition. Also having treatment planning, so work with your team to develop a comprehensive treatment plan. And this may include aspects such as medications, physical therapy, exercise, and lifestyle modifications, and schedule regular follow-ups to monitor progress, adjust treatments, and address any new symptoms or challenges. Of course, this can all add up and cost a lot of money. So if you're able to have a chat with your doctor about getting a chronic disease management plan, and that will allow you to have those 5 subsidized visits to any allied health professional in a year. So how can a GP or a rheumatologist help someone with fibromyalgia? So they can help connect them with specialists, health professional and services. They may make the initial diagnosis themselves, or they may refer you to a specialist such as a rheumatologist who may formally diagnose you. So after a thorough assessment of fibro, your GP or specialist will work with you to create a care plan to help manage your treatment and services. So they may prescribe medications to help with your symptoms, and will schedule regular checkups to monitor your progress. So a rheumatologist, for those who may not know who they are, it's a doctor who specializes in diseases of the bone and joints, and not every muscle and joints, and not every person with fibro will need to see a rheumatologist, but many may. So your GP may refer you to a rheumatologist for diagnosis, especially if the cause of your symptoms is really unclear. They also may refer you to a rheumatologist if your symptoms are not improving or are worsening, or if you and your GP wish to seek advice about newer treatments. So a rheumatologist may also suggest non-drug therapies. They might prescribe medications where appropriate and provide self-management advice on the best way to manage your condition. If you have another inflammatory form of arthritis like rheumatoid or lupus, your rheumatologist will be able to help manage all of those conditions. It's important to note that each person's fibromyalgia is different and it does affect everyone differently. And due to this, your rheumatologist might try multiple treatments over time to find the best one that is suited to you. So let's have a chat about some other health professionals and how they can help. So a physiotherapist, they can provide treatments such as movement therapy and activities in water. So, hydrotherapy. And these will help get you moving safely again. Physios can also help provide you with tips on managing your condition daily and provide education on proper techniques and posture to help you live well with fibro. So an exercise physiologist, I'm going to refer to them as an EP. They can provide advice on exercise, proper form and techniques to help prevent flare-ups and injuries. An EP can also create a tailored exercise program that addresses the unique needs of each person living with fibromyalgia. And they can advise how you can get started safely and the best type of exercise you can do for your health and ability. And if you are above a healthy weight, they can also help design a movement program to help meet your weight goals. So we do get questions about what's the difference between a physio and an EP. And just to put it really briefly, they both work to improve your physical health, but they focus on different aspects of care. So a physio may primarily treat and rehabilitate patients with injuries and disabilities or chronic conditions through, manual therapy, exercises, and education. And they often address immediate pain relief and recovery. Whereas an EP, they specialize in designing and implementing exercise programs to improve that overall fitness and manage chronic diseases. And they focus on that long-term health, that preventative care, and improving functional capacity through exercise. So both professionals are essential for managing arthritis, but their approaches and areas of expertise differ. And a dietitian. So these can be important for helping you design meal plans and improve your overall health, and make sure that you're getting adequate nutrient intake and minimizing the risk of nutrient deficiencies. So a dietitian can provide education on balanced diets and healthy eating habits, which may help reduce some fibro symptoms like fatigue. So if you're above a healthy weight, they can also help design a food plan which can help you meet your weight goals. So an occupational therapist can teach you energy conservation techniques, recommending adaptive tools and assistive devices, and modifying daily activities to reduce pain and fatigue. They can provide strategies for managing stress and improving sleep, which may help reduce symptoms of fibromyalgia. A pharmacist can help by making sure you understand your medications, which include proper dosages, side effects, and drug interactions, and they can provide advice on managing medication schedules and repeats. And then there's pain specialists. So this is a doctor who specializes in diagnosing and treating people with pain conditions that are really difficult to manage. They can offer counseling to you and your family, make sure you are using medication safely, and provide advice on alternative therapies. The many pain specialists are based in multidisciplinary clinics within the public and private hospital. So not everyone with fibro will need to see a pain specialist. There's also sleep specialists. So these are a doctor or psychologist who specializes in diagnosing and treating sleep disorders. So some people with fibro may have other sleep disorders like restless leg or obstructive sleep apnea, and these require the help of a sleep specialist, but not every single person with fibro will need to see one either. Then there's psychologists or counselors, so they can help manage your worries, your anxieties, fears, or feelings of sadness that may stop you from changing. They may stop you from changing the way you live with pain. And you can also get a mental health care plan from your GP, which allows you to have 10 subsidised visits to a psychologist or counsellor in a year. And then there's Arthritis Queensland and Arthritis New South Wales. So we can provide you some information on fibro through our e-news, our webinars, just like today, our information pack. So we have a fibromyalgia booklet here. We can also link you with a peer mentor with fibromyalgia in our Arthritis Assist service, or even joining our online support groups. We do have 3 different exercise programs available. So Arthritis Moves, that's one done with an EP. And then we have Dance for Arthritis with Queensland Ballet. And then our newest one, which is Tai Chi for arthritis. And if you're based in New South Wales, we do have warm water exercise classes as well. All right, so remember, the most important member of your healthcare team is you. So by understanding your condition and learning how you can manage it, you can give yourself the best chance of leading a fulfilling life. So learn about fibro and play an active role in your treatment. So not all information you read or hear is trustworthy. So always listen to your doctor or healthcare team about treatments you are thinking of trying. So there's some really amazing and free self-management courses and chronic pain courses. And this can help you develop skills to be actively involved in your healthcare. You can also find ways to manage pain, and it can be useful to change the way you think about it and react to pain. So a psychologist can teach you skills to help you manage your pain, and you can collaborate closely with your healthcare team to create a management plan. So after diagnosis, it's really important to get education about fibromyalgia, discuss treatment options, and learn the best self-management strategies. And it's really important to stay active, as exercise has been proven by research to help with pain and other symptoms. And it always makes us feel really good, but it's really important to always start gently and slowly and build up as you go. So when you become fitter and stronger, so start off small and just add on and build it up. So the next one is to balance your activity and rest. So learn to listen to your body and be guided by it. So try to space out your week's activity to give yourself time to rest. And if you're having a bad day, be ready to change your plans and not force yourself to work through that pain. So pacing is really important, where you break down a big task into little chunks and just do little bits at a time. You can also have a chat to your doctor or rheumatologist about medications. So typical arthritis medications have a chat about, such as pain relievers and anti-inflammatory drugs. So these are not usually helpful in fibromyalgia. So having a chat with your doctor or rheumatologist about finding that right treatment can involve some of that trial and error, since there's not a one-size-fits-all solution. And different people respond differently to various treatments. So always talk to your doctor or pharmacist or rheumatologist before starting any medications. And that includes natural and over-the-counter medicines, as they can have some serious side effects. Acknowledge your feelings and seek support. So there is no cure for fibro or for any other forms of arthritis for that matter. And this can affect many parts of your life. So it's natural to feel scared, frustrated, sad, and sometimes angry. So be aware of these feelings and get help if they start affecting your daily life. And before any appointment with any healthcare team, think about what's most important for you. So some people like to bring someone along, like a partner, friend, or a family member, to support you during any of your appointments, because it can be really helpful to have someone else there to help remember information that healthcare professional has said, and also providing support through those appointments. All right, so managing emotional and mental well-being. So recognizing the emotional impact. So as discussed in the previous slide, always acknowledge the emotional challenges of living with fibromyalgia and other forms of arthritis. And these can include feelings of frustration, anxiety, and depression. Seek support, so engage in counseling or psychotherapy. Speak with a psychologist to develop coping strategies and address those emotional concerns. They can just be a really great person to listen to your worries and be that sounding board when you're having a tough time with your condition. Practice mindfulness and relaxation techniques such as meditation, deep breathing, and yoga. This can help reduce stress and improve mental well-being. So we'll go into a bit more detail of this in the next slide. Joining our support group. So it's really nice to connect with others who have fibromyalgia through our online support groups. Some towns might have in-person support groups as well. And then we have that peer mentoring service, Arthritis Assist. So it's really nice to share experiences and gain that emotional support from somebody that has that same condition as you. So learning simple mind techniques may help improve your ability to manage pain and symptoms effectively. So while these methods may require practice, seeking guidance from a trained professional like a psychologist can be really helpful. So some GPs, nurses, and physiotherapists have also been trained in these techniques as well. There's lots of information online, lots of free apps and podcasts and all of that to help learn mindfulness and relaxation techniques. So relaxation methods such as slow breathing, guided imagery, which is visualizing mental pictures, and progressive muscle relaxation. These all may help reduce stress, anxiety, and muscle tension. And there are various relaxation techniques available, and you may need to experiment with several of them before finding one that is best suited to you. And it's really beneficial to practice relaxation throughout the day and in different settings, even while engaging in other activities. This allows you to utilize relaxation techniques whenever needed without having to wait until you're at home. Mindfulness involves focusing on the present moment without judgment or distraction from unhelpful thoughts. It can aid in calming your mind and reducing the impact. And distraction involves directing your attention away from pain and putting it towards something else. So this could involve imagining pleasant scenes or engaging in enjoyable activities such as listening to music, reading a book, solving puzzles. Some people draw, paint as well, and that's a form of distraction. Many people already use distraction quite naturally, but consciously reminding yourself to do it when possible. So even if you manage everything correctly, you may still occasionally experience a flare. So a flare is a sudden temporary worsening of fibromyalgia symptoms, and it usually involves more severe pain, but some people may experience flu-like symptoms such as fibro fog and extreme fatigue. For some, the symptoms can become so intense that daily tasks become impossible. Flares can be really unpredictable in timing as well, and they can occur without much warning. Often there's no clear cause, but they can sometimes coincide with a viral infection, and some people find that stress, overexertion, poor sleep, and even weather changes can trigger flares. So it's important to identify these triggers. So some people keep a symptom diary to identify triggers such as stress, overexertion, or certain situations. It's really important to rest and pace yourself during a flare. So allow yourself to rest and avoid that overexertion. Balance activities with periods of rest to prevent that further aggravation of symptoms. And pacing is a practical and mindful approach to managing your symptoms, your daily activities. It involves finding a balance between rest and activity to prevent overexertion. Sorry, my dog is just barking. And minimize the risk of triggering or worsening a flare. Pacing focuses on breaking tasks into manageable chunks and listening to your body's cues to avoid pushing yourself too hard. Curly, sorry. Use pain management techniques. So apply heat or cold packs, practice gentle stretching, and take medications as prescribed to manage pain and discomfort. It's also really important to stay hydrated and eat well. So maintain a healthy diet, eat lots of fresh fruits and vegetables, and stay hydrated to support overall health. Early. If you're concerned, talk to your doctor to review your treatment plan. They can also help create an action plan for future flares. So any new or unusual symptoms should be investigated, as they might indicate a new illness rather than a flare. Remember, flares are to be expected and they will eventually pass, but in the meantime, allow yourself to take it easy and rest. All right, so now we're going to go through some additional resources and support services that can help you live well with fibro, and some of these that you might want to reach out to and utilize. So we do have the fibromyalgia booklet as well, and that can be in hard copy or as a digital format. So you can access that on our website. So Arthritis Queensland and Arthritis New South Wales. So you can phone us on our 1-800 number to organise for it to be posted out to you. There is also a Fibromyalgia Australia website. So they work to improve research and services for Australians who have fibromyalgia or chronic fatigue syndrome as well, and other associated conditions. So you can visit their website there at Fibromyalgia Australia. There's also Pain Health. So they have clinically supported information. They have tips, support, and personal stories to help you manage any type of musculoskeletal pain. And then there's some really great information that you can access through Health Direct. For advice on healthy eating and appropriate exercise, you can contact My Health for Life, which is a Queensland-based initiative. And then if you do smoke, there's some advice on quitting smoking with Quitline. And if you would like to find a rheumatologist near you, you can get a referral from your GP, and you can have a look online as well and at the Australian Rheumatology Association. And to find a physiotherapist, you can jump online to the Australian Physiotherapy Association website or give them a call and they can help direct you to a physiotherapist near you. And the same with an occupational therapist. You can visit their website there, as well as the exercise physiologist. So you can contact the Exercise and Sports Science Australia. And to find an accredited dietitian, you can visit Dietitians Australia. And to find a psychologist, you can contact the Australian Psychological Society on their website. All right, so now I thought it'd be really beneficial to have a chat with our beautiful peer mentor volunteer, Geraldine, who lives with fibromyalgia and can share her lived experience of managing such a misunderstood chronic pain condition. So, welcome, Geraldine. Thank you so much for being here with us today and sharing your knowledge and experience around fibromyalgia.
Thanks, Bree.
So I thought the first question that we could start with is, what is it like to live with fibromyalgia?
Oh, well, it's certainly not something I really enjoy living with. I'd be very happy to share it with others or even give it to you, but I don't think anyone else would really be putting their hands up for it. It's a really complicated, annoying, and persistent condition. And some days are good and some days are bad. And then if you've got other issues like you talked about, like arthritis in whatever form, you have a mixed pain state. So you live with this. Is it another condition? Is it my arthritis, or is it just my fibro playing up? So that can become a little bit complicated at times. The daily pain and fatigue. And again, my worst time are mornings and evenings. Other people can have other times that are bothersome. As you said, if you've got things coming up, it can be really frustrating because you really want to do things, but you've just got to take it a bit slower. In time, I've learned how to manage that, but in the early stages, it was really hard. The brain fog, I get that. I've now learned that it gets worse, the fuzziness, the lack of concentration or memory. I'll just stop myself when I'm feeling like that because I know that my brain is working too fast. I'm living too much in my head, and my brain's basically a message from my brain saying, stop it, I can't process all that you're putting through me at the moment. So I've learned to slow down and do something different, get out of my head and into my body more, or just into life a bit more. I have IBS. I've had that since my 30s. Again, that comes and goes, and it's all very related to my emotions I've learnt over the decades. Or if you do have a virus, because your immune system's run down, it can really make your tummy, it just gets cranky, and it's basically telling me it's not very happy. And I've learned to listen to all of these sensations that for decades I just pushed away. But I realize now that they're actually messages my body's giving me that there's something not right, and that it's time to slow down, think about it, and find another way to deal with it. So that helps my IBS, as does just eating a more natural diet. I have food sensitivities. So I can't eat certain foods. I went to a dietitian and a nutritionist and naturopath, and my diet is a lot more, I suppose, healthier. Sometimes if I sort of eat other things that probably I don't usually eat, it'll tell me it's not happy, but it doesn't mean I can't enjoy things. Also, my sleep issues, I've tried a whole lot of medications because I do have restless legs. And when you're lying there in bed and there's nothing else to distract you, all of these sensations in your body are just alive. Like you feel the energy moving around everywhere. And then you go into that dark place of watching them and becoming a bit hypervigilant, and then you just can't sleep. So I take medicinal cannabis oil at night. That helps me. Other people, I've tried melatonin. That sort of made me feel a bit woozy the next morning, but other people really stand by it, people I know. I slow down my pace a lot more when I get stressed, because as you said, stress and illness will amplify the pain volume and also amplify the fatigue that I feel. So the way I've had to change my life is have more balance in it. So all the time be thinking like, I have some activity, then I have to rest. I have some time where I'm thinking and problem solving, and then learn to switch off and be more relaxed, or do some more things out in nature and just enjoy being with my dogs or painting or something. That is easier said than done. A lot of these things and all the things you've listed here, they sound really good, but to actually change the patterns of a lifetime are really hard. And it's, as you said, it's just little tiny slow steps done regularly help you to learn how to change patterns of behavior and thinking and fear of movement and worry about what could happen, what may happen. You just got to learn to live in that present moment, because otherwise I'm making up stories about what could happen, and that makes my brain get really anxious, which then makes my muscles get tight, which then makes my gut start playing up, and it's like a cascading effect. I have to go with the flow of life, I suppose, more, and just listen to what my body's been telling me for decades. And I thought I knew best, and I'm now learning my body. I've got to believe my body is pretty good. It's lasted a long time, and it's actually got to the point where it's sort of said, you either stop doing what you're doing, or I'm just going to turn this pain up. That's how it feels. The pain dial's turned up, and it's just going to stay there unless I start to show it, give it evidence that I can look after myself better by all the things you've listed on your sheet there. So that's what it's like living with it every day. And I try to enjoy it. There's more than life to enjoy. You know, there's more going well in my life than's going bad. I have to keep remembering that. You know, and what it was like a couple of years ago, I'm much better than what I was then. I'll have bad times, you know, that'll knock me out and I'll be in bed all day. But even when I have the bad days, I still make time to just get up and move. Body wants to move. It needs to move. Because if I don't move and I don't eat well, you know, and if I start drinking wine to calm myself down, or I start taking too many tablets or whatever, I'll just make myself feel worse. So I've learned to just go with it a bit more.
Okay. Beautiful. Thank you so much for sharing, Geraldine. And I think it's really important to note, like, all of that Geraldine's experience with fibromyalgia can be completely different to somebody else's experience, and what works for one person may not work for the others, because it is such an individualized form of arthritis, like every other form of arthritis as well. But it's all about collectively doing so many different things to help support you and better manage your condition. So another question for you, Geraldine, is that in the most recent chronic pain report, the typical time it took for somebody to get a diagnosis of a chronic pain condition was more than 3 years. And a concern felt by many came around comments such as, why do they say it's in my head, but I have pain and issues in my body? I get the feeling that they think that I'm making it up or I'm being lazy. So how would you respond to this, you know, this comment around this?
Okay. I think most people, the biggest issue is people think you're lazy, or why aren't you getting better? That's the other thing. Because they only know the first type of pain, which is acute pain. And you talked about it before, acute pain is from an injury, an illness, or an accident or surgery. And everyone's had that or a flu or a cold and you get better. And they go to their doctor and they get better. How come you can't? And you go through that and you start to question yourself. But persistent pain is a totally different type of pain. It's real pain. And the biggest thing is no doctor has ever told me ever when I went to them earlier that there's two types of pain and that they are different and that each form is real pain. It's just that the persistent pain is pain that the brain has learnt. It's learnt that pain because you've had pain for so long, more than 12 weeks. So as you said before, even though the body's healed, and in my case, I had a hip surgery that really made it really flare up, and that hip surgery didn't get resolved in time. And I was so worried, and people kept telling me I should be doing this by week 3 and by week 5, and I wasn't doing it. What's wrong? And then the pain dial just gets worse and worse. And the doctor would say to me, the body can heal, the body can heal. And I'd say, well, why isn't it healing? Or you're just procrastinating, not procrastinating, you're just catastrophizing. And all that made me feel like I was all at fault. But the pain was real. And it wasn't until I went searching for the answers myself, and it was through an old webinar I used to have with a rheumatologist, he's now deceased, but that I found out that this was actually a syndrome, what I had. I didn't make it up. It was all these different things combined, because a syndrome isn't an illness. A syndrome isn't a disease. A syndrome is what you said. It's after they do all of these tests that I felt like I was on a merry-go-round, going round and round and round. I do a blood test, I do a test, I go to a surgeon, I have an up, I feel all excited, I come booming down with a real sense of despair. I'd go and nobody could find an answer. How I spent all this money, I spent all this time, what's wrong? But really, if they would have told me that's the only way, they have to cross out all these more significant illnesses and diseases before they can give a diagnosis. But that would have helped me, but they never did. And so I started to second guess myself. And actually 10 years prior to my diagnosis, I did go to a surgeon for my neck, and he said, it's not your neck. Because I have all these different problems with me, he thought it was fibromyalgia. Go and talk to my GP, he'll sort you out. GPs can help you. And the GP just ignored me. He said, that's silly. No, you just got OA, because he was focusing on the disease rather than looking at me as a whole person. Fibro is a whole person condition. Okay, multiple systems in our bodies are playing up. I have skin issues, I have allergies, I have the fibro fog, I have pain, fatigue. It's multiple things. It's just not one thing. And I learned over time that if I can calm my mind and just be with where I am at the moment, the body then relaxes, and I tune into the muscles. It all starts to go. I'll put my hot pack on my back before I do it, just to give myself some self-care. I feel I'm doing something. I've got to feel like I'm doing something. And then slowly, I've learned to just wind it down. And I just sit there and just be with myself. It could be just 5 minutes, 10 minutes, because that wave that comes, once that calms, I'll just stay with myself. And then I go, okay, I'm okay. It's calming down. I just got myself into a bit of a head spin. If I calm down, I just do like you do it, little gentle stretches. Just wake up my body and coax it. It's going to be okay. I try really hard not to be my worst enemy by getting angry with myself or really getting frustrated, because all that does is send messages to my brain through my central nervous system, which has become sensitized from years of living with this, to say danger, danger. And the brain just goes, oh, she's having problems. We'll turn up the pain so she stays there on the bed. But if I can just calm the mind and say, I've got this, I've got this, and I talk kindly to myself, which is totally different to a lot of the things the world tells us to do. So the pain dial goes down. And so I've learned that I'm not being lazy. I'm not making it up. I've just sometimes got to just be kind to myself. And then often people see that I've got this managed. I've got some strategies. They don't usually say things like that to me anymore. Or I'll just say, I just need some space. I need some time. I just need to pace myself. So that helps too.
Amazing. Thank you so much, Geraldine. You are definitely a wealth of
Oh
knowledge.
dear, I'm not used to talking myself to other people. I don't usually talk about these things publicly.
Oh,
They're
you've
very
been
private. Yeah, they're very private.
Yeah, and thank you so much for sharing your experience.
Yeah.
It means a lot. And I can see in the
Yeah.
chat box, a lot of people can relate to you and what you're saying. So it's really nice to have that
Yeah.
justification that other people are experiencing it too.
We're not broken. We're not damaged. We're just scared of what's happening to us. And we're sore and tired,
Yeah,
Go away.
definitely. Okay, so the next question. So I've got two more questions and I think we'll combine them together.
Yeah.
So a common thing that we see as well is, how do I explain this condition to other people? They look at me weird, like I'm weird. They tell me just to push through it, and don't think about the pain. And also, as you've mentioned, it's a whole life condition. It affects a number of different body symptoms. How do you manage fibromyalgia daily, and what mind and body strategies do you utilize?
Well, I don't take a lot of those very powerful drugs that the doctors originally gave me. I've gradually weaned myself off them. Some of them quite painfully through withdrawal symptoms. Many of them are very addictive. I use medicinal cannabis oil. I find that quite helpful. For me, other people don't. I just accept all these symptoms are connected. So one thing's happening in my body, it's not just going to be happening on my skin, on my face with rosacea or eczema or something. It's also going to be happening in my gut. It's going to be happening in my immune system. And then that sends a cascade of hormones and things rushing through my body. So it's all connected, which doctors don't work on. They don't seem to work on the connections. They just work on body systems. And that I've learned that my body is actually trying to tell me something. It's not my worst enemy. It's actually my best friend that I have not listened to. And I thought I was right and I could work through it. I could push through and that. And now that it's as if sometimes I thought my body's ganged up on me. No, it hasn't ganged up. It's just trying to quite strongly tell me now to change what I'm doing. So I'll use a range of different things, like all the things you talked about. I'll use medications when I need to for different parts of my body. I use natural heal of heat and cold. I work with trying to improve my gut with healthy foods. My fatigue, I see that as like a rechargeable battery, and I have only a certain amount of charge in that battery in a day. And because I have sensitization through my system, that's going to churn the power, churn the energy a lot quicker than what somebody who doesn't have it. So I have to pace myself, work out each day, what can I fit into the day? How am I going to do it? Try and make some spaces in my day for the life just to happen, because it will. And just acknowledge that. I do the breath work. I stopped being a perfectionist. I was such a perfectionist. And I've now tried to just be more accepting of what's happening. And meditation, mindfulness, breath work, going into the body, listening to the body, looking at the somatics, all of those things, yoga, tai chi. I do qigong. I like qigong. All those Eastern type things, they really calm you down, slow the pace. You know, we're rushing around, just slow it down. I do exercise every day, but I look at it more of the joy of movement. And when it's not a joy, I have a rest and I might pick it up again a little bit later. I do a lot more self-care type things for myself. I lock myself away sometimes and I just do what I want, my art. I go out in nature. I practice the cognitive-based therapy approaches you talked about of pacing, graded exposure, mindset. MindSpot was a great free course you can do through New South Wales University. I did that. It's all online, and the counsellor at the time rang me up once a week to talk about it. That was really good, and about how the whole issue is you go to a restaurant to have a meal with friends. Well, it's a layered effect. It's just not going to, it's about driving the car. Where am I going to park? The walk there, you know, all of it. How is my gut going to go today? And it's about just seeing what happens, of staying in the moment and just not just sort of making up stories about what could, but just seeing what does turn up. Often our biggest worries don't ever turn up. So I've learned to do that. I ask for help more. I do online shopping. I have to learn to say no to people more often. And I have to put myself first on the list of people to please. I used to always have myself last. I'd run around looking after everybody. And I'd run myself ragged, and that was okay, and I didn't talk about it. But in the end, my body kept score of that, and then I got really ill. Yeah, this didn't start 6 years ago. This started when I was a child, you know, and I learned those patterns of behaviour, you know, of looking after people and being super busy and being capable, and it's just built up over time. So we're a time capsule of everything that happened to us. And I, as you said, I've had counselling. It's been really good for me. It just sends me in the right direction. So they're just a few ideas that I find. There's heaps, but, you know, you best pick a couple to start with. You can't do it all at once, and just practice it. It'll feel weird because it's everything you don't usually do. Especially relaxation, meditation. That's hard if you live in your head. You find this, I did a course and said, find the spaces between the thoughts. And in those spaces, that's where you start. Yeah, so I hope I give some people some ideas. Now you can pick one thing out, give it a go, you know, be kind to yourself.
That's exactly it. That's so beautiful, Geraldine. And I really appreciate you sharing your knowledge and experience, and especially ways that you manage your condition daily. Because as you said, it's a whole systems approach, just not one thing. It doesn't affect one thing, it affects everything. So, you know, it's nice to try one of these strategies and give it a go and see how you feel. And when you're up to it, try something else and just keep building onto that. All right. So what I'll do is that I'm going to stop the recording.